We have team coverage tonight on the confirmed case of measles in Spokane. Sean Chitness brings us facts about the measles, puts into perspective in comparison to more dangerous diseases. Whitney Ward looks into viewer concerns over babies who aren't quite old enough to get vaccinated. And Taylor Vito learned how health investigators are looking into how the patient got it and who could be at risk.
KREM 2 News at 5 starts now.
Well, good evening. It's good to have you with us. I'm Jane McCarthy. Randy's off tonight. For the first time in 21 years, health officials have announced a confirmed case of measles in Spokane County. The person infected is still sick, but is no longer contagious. Health district officials are working to find out how the unvaccinated person was exposed in the first place and who he was in contact with when he was contagious. We're focused on giving you facts, not spreading fear. KREM 2's Sean Chitness looks into how rare the measles is in the U.S. and how it compares to more dangerous diseases. Sean?
Jane, the most recent numbers available from the Centers for Disease Control show there are more cases of TB and whooping cough. Measles also doesn't make it onto the list of top 10 causes Americans die from each year. Just some of the facts the Spokane Regional Health District says you should keep in mind. A case of measles in Spokane County, the first in 20 years. The symptoms are serious, but you shouldn't be alarmed. How deadly is measles?
Measles can be very deadly if they're in the appropriate situations. So we're lucky in this country in that we don't have a lot of measles.
The majority of cases in the U.S. are among children. 1 in 1,000 will get the disease, and for every 1,000 that have measles, 1 or 2 will die from it.
These diseases are preventable, and we know how to prevent them.
Last year, there were around 600 cases of measles, but before the vaccine, there were millions of cases. In fact, before the vaccine, 500 children died from the disease each year. The measles, mumps, and rubella, or MMR shot has made a dramatic difference in saving lives.
Yeah, your risk of getting measles if you're vaccinated is extremely small.
According to the CDC, the top 10 causes of death don't include measles. Heart disease, cancer, diseases involving your lungs, accidents, and stroke make up the top 5. Influenza comes in at number 8. People should be more concerned about the flu than they should be about measles.
Well, your risk of getting the flu in the first place is generally higher.
It's important to keep in mind the situation in the U.S. and other countries around the world. In places where they don't have access to the measles vaccine, the death rate can be as high as 30%. In the studio tonight, Sean Chitness, KREM 2 News.
Sean, thank you. Measles symptoms are similar to a cold or flu. The symptoms include high fever, cough, runny nose, red eyes, and rash. About 3 in 10 people who get the measles will develop 1 or more complications, including pneumonia and ear infections. Those with the highest risk of contracting measles include pregnant women, babies younger than 12 months old, anyone with weakened immune systems, and of course people who haven't been vaccinated against the measles. Doctors say getting immunized is critical to stopping the spread. Already this year, 162 people from 19 different states have contracted measles. That's according to the Centers for Disease Control. Most of those cases, 117 of them, were linked to the Disneyland outbreak in California. It is recommended that kids get their first measles vaccine at 12 to 15 months old and their booster between age 4 and 6. So where does that leave babies? You on your sides, Whitney Ward is looking into that part of our story tonight.
Spokane Regional Health has said all along that vaccinating your kids is the best way to protect them. But what about the little ones who are too little to actually get those shots? Well, it turns out for those parents and babies, it is a real concern.
He'll be a month tomorrow.
For new mom Marnie Miller-Keys, measles isn't just a disease in the news lately, it's a potential threat to her newborn baby Desmond.
I mean, it makes me rethink taking him out in public places, to the grocery store.
It'll be another 11 months before doctors recommend that little Desmond get his first MMR vaccine.
Now all of a sudden it's here in our city. Does that make it more real?
Yeah, because I mean, this person was in the Qdoba on the South Hill, and I haven't been there recently, but I could have.
I asked Spokane Regional Health if moms like Marnie should be worried.
Is there any reason for them to be more protective about where they take those babies in public places? Because again, we don't want parents to overreact and,
Right.
and just, kind of become homebodies because they're afraid to take their kids out. But is there a risk?
Oh, that is a tough question. I wish I could say that there's no risk. The truth is there's some risk. It's low.
But in fact, doctors say the biggest threat to babies isn't strangers out in public, but those closest to them.
Really make sure that you verify the vaccination status of everybody that's in close contact with your baby. The adults, caregivers, grandparents.
Marnie says she's glad she's been vaccinated, so at least baby Desmond is getting some of her antibodies from nursing. But she says when it's time, she'll be making sure he gets his shots too.
I think it's irresponsible not to get vaccinated, personally. If you're educated about what vaccinations actually are, there's no reason to worry about it.
So if you do have any questions or concerns, it's best to talk to your doctor about how to best protect your baby. In Spokane tonight, Whitney Ward, KREM 2 News.
And another new study shows no link between the vaccine that protects against measles, mumps, and rubella and autism. The study included nearly 100,000 children. Researchers found the MMR vaccine was not associated with increased risk, and this was true even if a child's older sibling was autistic. Spokane Public Schools held vaccination clinics last week to bring all students into compliance with state law. Students must either be immunized or provide a certificate of exemption. In November, about 5,000 students were not in compliance. Now there are only 89 students not in compliance. That's out of about 30,000 in the whole district. About 2,700 students in the district have exemption waivers. We received some questions on Facebook today from people wanting to know if those vaccination clinics the school district held actually spread measles into our community, causing this case. Well, Two on Your Side took that question straight to health professionals who say that's just not possible. Find out why new tonight on KREM 2 News at 6. And health officials say a person with measles is contagious for about 4 days before a rash appears and roughly 4 days after the rash is gone. Here's a map of all the locations this patient visited while he was likely contagious. Make sure and check the following times and places on your screen. The health district says on Sunday, April 12th, he was at the Qdoba restaurant on South Grand on Spokane's Lower South Hill from 3 o'clock in the afternoon until 11 at night. Then on Monday, he spent time at the North Park Racquet Club on North Division in Spokane from 1 in the afternoon until 6. He spent several hours on Wednesday at the Franklin Park Urgent Care on North Division from about 3:45 to 7:30. He was also at the Providence Holy Family Hospital on North Lidgerwood on 3 different dates. He went into the emergency department on Thursday last week around 9:45 at night. He was there through Friday at 5 in the morning. And again on Sunday from 11:30 in the morning to 7:30 at night. If you haven't been vaccinated, health officials recommend getting one now. It can still be effective even if you get it up to 3 days after you're exposed to the virus. The Spokane Regional Health District is now in the process of trying to figure out who came in contact with the infected man and, more importantly, if those people have received a measles vaccine. Before that, the investigation centered on talking with the patient over the phone and asking him where he was and what he was doing in the weeks before he became sick. Taylor Vito spoke with an expert about how they tackled that investigation. Taylor?
Well, for now, the Spokane Regional Health District is focusing on the people they know the sick man came in contact with. The district is focusing on contacting those people and speaking with them, and they're most concerned specifically within that, trying to figure out which of those people have received a measles vaccine. The Spokane Regional Health District's investigation actually began on Sunday when they received word from the hospital about the potential case. On Monday, the district then asked both Franklin Park and Holy Family to check the vaccination status of their employees and start working on who might have had contact with the man.
We do this even before we have laboratory confirmation because it is a tremendous amount of work.
Also on Monday, before test results came back, they contacted the man over the phone. Using this 2-page questionnaire, they asked him to recall where he was in a 3-week period before he became ill and if he came into contact with any other people who were sick as well.
For every single day, we would ask, where have you been and for how long and who were you with?
Health officials are trying to figure out where the disease came from and who else might be infected. From there, the healthcare facilities are tasked with contacting their own employees, patients, and others who might have come into contact with the man. The health district is handling reaching out to people who came into close contact with the man at Qdoba and the Racket Club. Altogether, the number of contacts is in the hundreds, I'm told. Health officials are primarily concerned if those people have been vaccinated. If they haven't, the district will then contact them to make sure they aren't feeling sick.
Say, do you have any symptoms now? We will probably monitor them for a short while based on the information that we gather.
It can be serious if it's determined that an unvaccinated healthcare worker came into contact with the man. That employee would then be furloughed for 3 weeks if that was the case. And health officials are also stressing if you are feeling the symptoms of measles and you are unvaccinated, be sure to give your healthcare provider a heads up before you come in to see them. That way they can limit your contact with employees and others. Reporting live this evening, Taylor Vito, CRIM 2 News.
Taylor, thank you. Coming up after the break, we're pleased to have Dr. Joel McCullough from the Spokane Regional Health District. He'll help us answer some of your questions about measles.
Weather news, get ready for that.
Welcome back. Many of you have a lot of questions about this measles case, about protecting yourself and your family from the virus. So we brought in an expert to answer your questions. We have Dr. Joel McCullough from the Spokane Regional Health District. Thank you so much for joining us.
Thank you for the invitation.
You bet. Well, there's a lot of information to get out there, and we asked our viewers to submit some questions on Facebook and Twitter. Our first one comes from Taylor, who asks, is vomiting a sign of the measles, and also is it possible to have it and not have the rash appear?
Vomiting is generally not a common symptom of the measles. Certainly people can have other conditions or symptoms that may not be related to measles at the same time, but generally vomiting is not a sign of the measles. And in terms of the rash, rash is a very common symptom of the measles. It generally comes about several days after exposure, and that's generally what gives clinicians indication that it might be measles because of the rash, because the symptoms before the rash are very nonspecific and can be pretty similar to a common cold. Yes.
Can you have measles and not get the rash?
It would be possible, but that would be unusual. If you have certain immunological conditions, or in rare cases, if you've been immunized inadequately, you can have an incomplete presentation, and so the rash may not be present under those circumstances. So, but more commonly, you will have a rash.
Okay, that's the telltale sign.
That's right.
If a person was vaccinated as a child, should they be revaccinated as an adult? This question coming from Claudette.
If an individual had the full immunizations of a child, having 2 doses, immunization as adult will not be necessary. However, if they did not have a complete, if they only had 1 dose, vaccination as an adult would be appropriate, yes.
And it's true that a lot of adults didn't get a second one, is that right? That they need a booster?
Well, it's possible that people did not complete the full series as a child, and we're recommending, if people do not know whether they got the full dosage, is to get the vaccine just in case, because it will do no harm.
It's not going to hurt you to get
do no harm.
extra. Okay.
That's right, that's right.
Also, Nicole wants to know, how many days does your body need to have the measles vaccine take full effect?
We generally talk in terms of full effect as about 4 weeks or so. However, there may be benefit to getting the vaccine. So, for example, currently we're recommending that those who might have been exposed and they're unimmunized to get the vaccine, because research has shown that if you do get the vaccine, within 3 days of exposure, that could prevent the disease or significantly modify the disease.
Yeah, make it a little easier on you.
That's right, that's right.
All right, well, that's all great information. That's all the time we have for questions. We're going to keep taking your questions on Facebook and Twitter, and of course, we'll be checking in with you. You've been very busy. Thanks so much for taking the time with us today.
Great. Well, thank you.
We'll be right back.